health seems to be a big issue. I mean, we've had to deal with it pretty much from the dawn of time, and IT's role in health is becoming increasingly important as we talk about more of our health being tied into, places that we can't necessarily see, but we can now get access to. Correct?
Yes.
Like, this is a big, well, I'd say burgeoning field potentially.
It's a huge field. It's actually really interesting because there's a perfect storm in healthcare right now. And the government has driven a lot of it through the incentives that came from the enormous stimulus package, that type of stuff. Within that, there's a HITECH Act that puts all the incentives and penalties in place for adoption of electronic health records. So it's really one of the last industries that has not gone through that IT transformation. So there are jokes about Jiffy Lube being able to capture all your customer information and hospitals can't. So the industry is absolutely going through that transformation right now, and it'll be probably through 2015, 2016.
Now, when you say perfect storm, what elements constitute that?
Well, there's obviously there's a lot going on. There's kind of three legs to the stool. So one of them is the electronic health records. There are significant incentive dollars at stake. So some health systems can get $100 million plus in incentives in place if they do it according to the way the federal government wants. Penalties can be much bigger than that if they don't get to that point. So the electronic health records are there. Everybody knows about healthcare reform law in place now.
Somewhat. I mean, I know as a consumer and someone who does have health insurance.
So healthcare insurance or providers, they all have to study what's going on with the law to understand how they need to reshape their business. So some of it is just business, some of it is IT related, things they need to adapt to be more successful in the new healthcare landscape. And the third one is there's a huge thing coming called ICD-10. And that's federally mandated to occur by October 2013. And all that means is...
Yeah, so you got to explain this to me.
So if you go in and you hurt your left wrist, there's a code that they put in there saying, okay, it looks like Eric hurt his left wrist. And there's a certain number combination in there that will track you through when you go in as a patient to when you receive your ultimate bill from the healthcare insurance company. So essentially, that's version 9, these sets of codes that you see, and the rest of the world is on version 10. So ICD stands for International Classification of Diseases, 10 is for 10th version, but it's a hugely complex endeavor because it's going from roughly 20,000 combinations of codes to about 200,000. Wow. So in the past, instead of saying, well, Eric hurt his wrist, they can break it down and say, well, Eric hurt his left wrist, and it looks like it's the ulna. You know, that type of granularity that we haven't had before.
So then what is IT's role in helping the healthcare industry get to where it needs to be?
Getting an enterprise-wide electronic health record system in place. So in the forefront, that's pretty simple and straightforward, right? They're capturing all your patient information. So they're figuring out if you're allergic to penicillin, surgeries that you've had, all those types of interactions. But as that evolves, they're going to take all the information they're collecting, start to do business intelligence and analysis and all that type of stuff with it to figure out that, hey, this guy had a heart attack in New Hampshire, this guy had a heart attack in Dallas, they're about the same demographic, which treatment worked better for him, which was more cost effective.
Would I be able to get access to those records if I, say, move or if I'm in a different location? Would this bring us closer to that type of access of information?
That's a really good question. I think that's where it's heading. There's not a lot of it now, but some of the more forward-thinking companies are figuring out ways to segment what needs to stay private and what wouldn't be publicly available. But a lot of websites now or hospitals will have initiatives where you can, as a patient, use your username and password, get in, look at the type of stuff you need to. Maybe it's a basic thing and say, I need to check and see what my balance looks like, or I need to schedule an appointment. Some of those basic type of things, those evolve over time.
I guess I'm spoiled. I have health insurance here, and I'm able to log in and get access to all my records, down to knowing how much I weighed when they took that measurement, 4 years ago. And I got to tell you, from a patient's perspective, it's really nice to know that I've given that information up. And like I said, maybe I am spoiled. Is this something that, I guess the IT sector is helping in a larger sense bring to more consumers, more patients?
Absolutely, and I think it's critical. So if I go to the doctor and I ask somebody how much a CAT scan is going to cost me to see if my sinuses are okay, nobody knows. There's no other industry like that where you have no idea how much something is going to cost and how much you're going to be on the hook for. So I think if you can empower the patient more with that type of information, we as patients or consumers can make a lot smarter decisions about things.
So what might, someone who is considering making a hire, what might they keep in mind for a professional in terms of their skill set? What is going to be more adaptable to the healthcare industry versus maybe other industries in the field?
Right now, most providers are stuck with the mindset that they're looking for people with very vendor-specific application experience. So just like you might hire a Microsoft guy or you might hire a Unix person, it's a little like that in that they don't necessarily cross over. People have that background and they stay in that track. So healthcare is pretty similar. There are packages you might not have heard of, like Epic or Cerner, things like that are the big boys in the industry. And right now, most providers are hiring people with that specific experience. I think over time, they're going to have to expand that to understand that, look, an A player from the financial industry or from manufacturing may be great for us. They just need to have those soft skills like great communication skills, great aptitude, learning ability, that type of stuff.
Are they finding more situations where they have to combine what would be two separate worlds to effectively get a new world?
Essentially, what's happening in most systems, there are some that are trying to tie that together with a portal strategy or integration of different systems. But for the most part, the activity that we're seeing is going towards a single source vendor. So enterprise-wide type of thing. So you may see a hospital rip out what they have in place and put something entirely new in place because they feel that package can cover the whole hospital system. And you may see others build on what they already have. But it's becoming more rare to see hospitals that have stuff in their clinic setting, stuff in their inpatient setting, or they have 3 or 4 different vendors tying it all together. It's just become too complex for that.
What do you imagine is going to happen after, say, we get past this incentive period? After the transformation, say, would have happened in a variety of locations.
I think what's going to happen is you're going to see more of those general IT workers that want to get into healthcare IT have the opportunity to, because right now, as you can imagine, there's a lot of inflation in healthcare IT specialized worker rates. So there are plenty of really qualified people out there that might be interested in the role at a significantly reduced salary position, that type of stuff. So I think in a few years, there'd be a real influx of people from other industries, both to cover that lower cost demand as well as helping out with the shortage of healthcare IT workers.
Well, if this wasn't a hot industry today, it sounds like this would be, if you're a betting person, putting your chips on healthcare for a growth opportunity in IT.
Absolutely, and it should be that way. Most experts think it's going to be that way through at least 2016, 2017, because the penalties are so enormous for noncompliance that there's going to be a lot of hot activity through then at least.
So do you see potentially a lot more acquisitions happening in the coming years, specifically when these deadlines approach and companies have not adapted to these changes?
This recession has been so bad that it's the first time it's really impacted the healthcare sector for I think the first time.
Oh, really? So in what way?
Just in general. So you have less patients coming in the door because you might be less willing to spend money out of your own pocket, even if it's only a deductible. There are less people that are carrying healthcare insurance because the unemployment rate is higher. So it definitely has impacted the healthcare sector, and I think the healthcare industry has always been thought of as a recession-proof type of industry, and a lot of places suffered along with everybody else for the last few years.
And if you had any advice to give to someone who was interested in possibly pursuing a career with IT in the healthcare industry, what would you say?
Perfect question. I get asked that all the time. I think the most important thing is to treat it just like you would as if you were a fresh college graduate coming out of college looking for your first job. You've got to be hungry. You've got to, I think the best advice is to take a generalized IT position that may not be as specific to the clinical or healthcare kind of flavor IT. Get your foot in the door, prove your worth, and then find your way to slide into another group and expand your skills there.
Sounds like a healthy way of going.
Yeah.